Welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist from Portugal, and today I would like to talk about solution-focused therapy. Um, the first thing that I would like to talk about solution-focused therapy is the controversy surrounding solution focused and the name, because solution focused therapy is more like an approach than a therapeutic model. A lot of well-known researchers and clinicians in the field of psychotherapy agreed that for a specific model to be considered a psychotherapeutic model, it has to explain the development of psychopathology, the human development stages. So how does the person goes from the early stages into the now with a certain issue, a certain question, a certain pathology. So psychotherapeutic models are try to explain the functioning of the human being, for the psychological side of the human being. And solution-focused therapy is not a therapeutic model because it doesn't have a theory behind, or a psychological or psychotherapeutical theory behind. Is more like an approach. And that said, solution-focused therapy is an approach linked to brief and strategic therapy. It's an approach of doing brief and strategic therapy, which it was influenced, or one of the influences of solution-focused therapy is in brief and strategic therapy, but also some family and systemic therapy as well. This specific approach was created or developed by Steve Shazer, Inso Kim Berg, and other colleagues in the late 80s in the Milwaukee Brief Family Center. So, as I said, this approach was very linked to brief therapy, to strategic therapy, and family and systemic therapies. This approach was created by the viewing of a lot of therapy hours, a lot of videotapes, where Steve DeShazer and colleagues analyzed what were the interventions, or the most efficient interventions that the therapist did, and utilize them and discard everything else. So the influences of solution-focused therapy are in the work of the Mental Research Institute of Palo Alto, the well-known MRE, which was the inspiration for a lot of systemic and family therapy models and theories, and also the brief and strategic therapies mainly regarded by the work of Richard Fiss, Paul Weekland, John Weekland, Paul Watzlawick, Don Jackson, and of course Jay Haley in the beginning. So the MRE was a great influence to Steve DeShazer in solution-focused therapy. Another great influence was the work of Milton Erickson, obviously, because Milton Erickson influenced not only Steve DeShazer but also the work of the MRE. So it was the logical progression. Erickson's view were very focused on the resources and the solutions of the clients, of the patients, and not only in the psychopathology. For Erickson, the resources were more important than the psychopathology. Another influence was the philosopher Ludwig Wittgenstein, I think it's Wittgenstein, and some of the Buddhist thoughts on solutions in life in general. So a lot of influences going on into solution-focused therapy. As a solution-focused and as a specific approach to brief therapy, the solution-focused therapist is someone that is very centered in the present and generalizing to the future. The past is not too important, for example, compared with some of the psychodynamic and psychoanalytical approaches. So it's very present, centered, and future oriented approach. And so the therapist has an empathic posture, an empathic relationship with the client, not only to validate whatever he brings, respecting, not judgmental, not criticizing, just respecting whatever the client brings, in a way to break the resistance or some form of resistance. At the same time, the therapist tries to expand to other directions the way that the client is viewing the situation, the problem, expand into other possibilities, focusing on solutions to the specific problem. So the work is always to focus on the solution. Some interventions are based on the empathic and acceptance posture from the client, from the therapist, as I described just now. Looking for previous solutions. So the solution-focused therapist, he believes that in the past the client was able to overcome problems, to overcome other situations, and the way that he overcome it was by generating solutions. So the solution-focused therapist looks into previous solutions, because if something that the client is doing is working, the therapist will will create an incentive to the client to continue to do that thing that it's working. So looking for previous solutions is one of the interventions. Another one is looking for exceptions. In all of our lives, whenever we think about something that is going terribly wrong, or something that hasn't worked as well as we expected, there are always exceptions. Moments, or a single moment, that we expected some results and we got another one. So for the solution-focused therapist, it's important to look for exceptions, and by looking to these exceptions, he can confront or ask the client for those exceptions, so the client realizes that at some point something went in a different way that the client expected. Also, the posture from the solution-focused therapist is to ask a lot of questions. Those questions are in variable form. Some are empathic questions, validating questions, exploration questions. So a lot of questions. The solution-focused therapist mainly directs and mainly leads the session, but also permits to be led by the client. So it's like a dance. Sometimes he leads, sometimes he is led. And asking questions is a form of leading the session. Some of the questions are focused on the present and the future. So, as I said before, solution-focused therapy is a very present and future-oriented approach. And as I said before, the therapist really drives the client to continue to do something that is working. He creates an incentive to the client to continue to do what is working and discard everything that doesn't do as well. Some of these specific interventions can't be pre-session change. The pre-session change is where the therapist asks the client what were the changes that occur between our sessions, or in this week, if we are talking about weekly sessions. Because the solution-focused therapist assumes that change is inevitable, it's continuous, so something has to change. If the client doesn't identify any change, the therapist can start the session by talking about that. Establishing solution-focused objectives. For as other therapeutic models or other therapeutic approaches, like for example cognitive therapy or CBT, solution-focused therapy, the solution-focused approach is a very goal-oriented goal-oriented approach, always focusing on solutions. So one of the main interventions is to establish goals, specific goals with the client. Other specific interventions are, for example, scaling questions. This is very common in the solution-focused approach. The therapist will often ask in the form of scales. For example, in the scale of 0 to 10, where 0 is nothing, feeling nothing, and 10 is feeling totally whatever. What do you feel, or what do you think you are in this scale? So it's they often do some scaling questions to 0 to 10. How do you feel? How do you think about it? What did it happen? So, and lastly, the most common, or the most recognized technique or intervention from the solution-focused therapy approach is the miracle question. Now, the miracle question was developed by Steve Shazer, and you can find a lot of versions of the question. One of the possible versions is this: I would like to ask you a question. I realize it could be a little strange. Try to keep up with what I'm saying. When you leave our session, you will do a lot of tasks. You may go out to buy some groceries, to do some dinner, to do some shopping. You will do a lot of tasks. Eventually, you will have some dinner, and you will rest a little before going to sleep, and eventually you will go to bed and go to sleep. While you are sleeping, you will have a dream. In this dream, a miracle will happen, and every issue that you have and that led you to me will be resolved, will vanish. Everything will just be okay, like a miracle happened. However, because it was in a dream, when you woke up, how do you look into yourself? What do you think that changed, or what others may realize in you to convince yourself that a miracle happened? Something like that. So there are a lot of versions into the miracle question, but it is the most recognized intervention from solution-focused therapy. Lastly, I would like to say that solution-focused therapy has some research and has some scientific base. However, most of the creators and the solution-focused practitioners, one of the things that they agree on is the lack of more research. So they are trying to get people to do more research on solution-focused therapy, because this approach is a very popular one in a lot of contexts. For example, when working with children, working with families, working in a school setting, working in clinical practice, and also in conjunction with hypnosis. There exists something called solution-focused hypnosis, which was popularized or created by Bill O'Halloran, one of the a former student of Milton Erickson. So there are some evidence, some research on solution-focused therapy, but it lacks. So it needs more research to validate a lot of the approaches from solution-focused. As a reading recommendation, I would like to show you More Than Miracles, the state-of-the-art of solution-focused brief therapy. This book was written by Steve Shazer and Yvonne Dolan, obviously with contributions from the other creators of solution-focused therapy. This book is a really great book on solution-focused therapy. It has its history, the development, specific interventions, some of the research and context, a lot of dialogues. A lot of the book is in the form of clinical examples, and I believe this is the last book from Steve Shazer, the last one that he written before he passed away. So this is my reading recommendation on solution-focused therapy. I will link the reference in the description of this video. I would like to thank you for your time and to be with me in this video form. I hope that you have a great week. Please be safe, please be healthy, be careful, and I'll see you next time.